great prostate debate. I'd like to talk with you about the myths regarding prostate cancer and treatments. As a board-certified urologist, I've treated thousands of men with prostate cancer and know that information about treatment options is crucial to positive long-term results. The first and most widely held myth about prostate cancer is that prostate cancer is only for old men. This simply is not true. Men are diagnosed at all ages with prostate cancer. It can occur as early as your late 30s and early 40s. All men age 50 and over should have a PSA screening annually. If you have a family history of prostate cancer, or if you are African American, it is recommended that you begin screening by age 40. This simple blood test is important because early detection is one of the best ways to ensure long-term treatment success. The earlier the detection, the easier it is to cure the cancer. The cancer is usually smaller and therefore more curable. The second myth is that watchful waiting may still be the best option for this slow-growing disease. Watchful waiting includes regular monitoring of your condition without treating the cancer. We call this active surveillance. In certain patients, such as the very elderly, doctors sometimes will recommend watchful waiting because prostate cancer usually grows slowly. But it's important to understand that prostate cancer is not always slow growing, and we currently do not have a test that shows if cancer is going to grow or not. If you do choose watchful waiting, you should undergo serial prostate biopsies every 6 months to a year to be sure that the cancer is not growing. Someone with a PSA over 10 or multiple cores showing Gleason 7 is not a candidate for watchful waiting. Emotionally, the patient must be strong enough to live with cancer in his body. I don't know that I could. With younger patients and even elderly patients who are in good health, I believe that these men who have a reasonable life expectancy, 10 years or more, should be treated. With the advancement in treatment options, there are now less invasive options available. Another common belief is that surgery is the best and only option for treatment. The American Urological Association recently released guidelines for treating localized prostate cancer, which actually include 2 alternatives to surgery or removal of the prostate gland. These include watchful waiting and radiation therapy, further broken down to include external beam and implanted seeds like Theraseed or Palladium-103. According to the AUA, all of these treatments have similar outcomes for men in low-risk populations, meaning men with stage T1 or T2A cancer, which is a normal examination or small abnormality limited to one side of the prostate, and a PSA less than 10 or a Gleason grade less than or equal to 6. As a urologist, I have performed many radical prostatectomies, but over the years, through research and clinical experience, I now recommend brachytherapy as one of the best treatment options in low-risk and intermediate-risk populations. One treatment does not fit all, and men should consider quality of life after treatment when making their decision. Current literature, now covering 15 years of data from our group and others, show that brachytherapy with Theraseed has equivalent or better cure rates to surgery in the low-risk group. I recommend brachytherapy for many reasons. The use of radioactive seeds in the brachytherapy procedure is much less invasive than surgery. In fact, you can watch a webcast of an actual procedure here on greatprostatedebate.com. Fewer side effects like incontinence and impotence mean a return to normal lifestyle after the treatment. Quicker recovery time lets patients get back to their day-to-day routines without major interruptions. Nearly half of the time, surgery can leave cancer cells behind, a not well-known fact. And most importantly, according to my clinical papers and independent clinical studies, brachytherapy offers equal or better results in terms of non-recurrence of the cancer as we treat outside the margins of the prostate by 5 millimeters, which is where the cancer would spread locally. Another myth is that impotence and incontinence are unavoidable after treatment. The good news is that these side effects can be greatly minimized or avoided entirely by choosing the most appropriate treatment. Many men diagnosed with prostate cancer are good candidates for brachytherapy, which has a less than 1% chance of incontinence as a long-term side effect, and a less than 10 to 30% chance of long-term impotence. Most brachytherapy patients treated with Theraseed who do experience impotence respond well to Viagra, Cialis, or Levitra to bring potency preservation to 80 to 90%. I will provide more detail on how prostate cancer affects you and your partner regarding issues of sex and intimacy in the webcast available here on greatprostatedebate.com titled Prostate and Your Mate. Many people believe that most men with prostate cancer will eventually die of the disease. Again, this simply is not true. In fact, the numbers of survivors and long-term survivors with no recurrence of cancer have increased dramatically with the advent of advanced research and treatment options. As a matter of fact, the American Cancer Society estimates that 1 man in 6 will be diagnosed with prostate cancer during his lifetime, but only 1 man in 35 will succumb to this disease. The death rate for prostate cancer is decreasing thanks to early detection. More than 9 in 10 prostate cancers are found in the local or regional stages. Local meaning the cancer is still confined to the prostate, and regional meaning it has spread from the prostate only to nearby areas. With treatment, the 5-year relative survival rate for these men is nearly 100%. Some men believe that if they have enlarged prostates or BPH, they are not candidates for brachytherapy. This is a myth. If properly evaluated with residual urine determinations, the amount of urine remaining in the bladder after a full urination, urinary flow rates, use of alpha blockers like Flomax and Uroxetrol, or shrinking the gland down in size with Casodex and Avodart, needles can be placed to insert the radioactive seeds. As with any diagnosis that impacts you and your family so seriously, you need to be armed with all the information and knowledge to help you make informed decisions that are right for you. There is no one treatment that fits all patients. Your friend or relative's prostate cancer situation is different from yours, so be sure to gather information from expert sources. For answers to your questions, view the information here on greatprostatedebate.com. Talk to your doctor or call the Theraseed Prostate Cancer Information Center at 1-800-458-4372. Remember, get the facts, take control, and find the best proven treatment option that makes sense for you.